Dr. Ken Landau. Thanks for watching. Let's talk about mirtazapine or Remeron. This is a drug first approved by the Food and Drug Administration in 1996, went generic in 2004. It's an antidepressant. More than 6 million prescriptions every year for this drug, used especially when depression is complicated by anxiety or difficulty sleeping. Good news is it's not a controlled substance. Structurally, it's different than all of the other kind of antidepressants. It's what we call a tetracyclic antidepressant, not a tricyclic antidepressant, a tetracyclic. The effect of it, well, it's antidepressant. It also treats anxiety. It's a sedative. It's an appetite stimulant, and it's an antiemetic. Not only is it used as an antidepressant, it's used for off-label uses. So for generalized anxiety disorder, it seems to be better tolerated than benzodiazepines and the SSRIs, drugs like Prozac. It's used for functional dyspepsia that affects about 1 in 10 individuals. There are 2 different manifestations. The use is principally for people who eat and then they feel full very soon after they start eating. It's what we call early satiety or postprandial fullness. Seems that the tricyclics and Remeron or mirtazapine seem to work much better for this condition. SSRIs don't seem to work at all. Insomnia, very good, often used instead of the benzodiazepines. It seems that it helps in sleep in people who have certain kind of skin conditions, that pediatric eczema, and it's good for chronic refractory itch when your skin just seems to itch, maybe because you have psoriasis or that atopic dermatitis, or maybe you have a lymphoma, a tumor of the blood cells. Maybe it's because you have some liver or kidney disease or itch of unknown origin. Also used for migraine prophylaxis, although some newer drugs, much more expensive, have been highly popularized lately. Also seems to be good for chronic tension type headaches, and it's used for schizophrenia for people who have the akathisia or the feeling of not being able to sit still. It doesn't seem to work so well on the negative symptoms of schizophrenia, for instance, a lack of social interaction or the apathy. It also can treat some pre-existing nausea or vomiting or diarrhea or even the irritable bowel syndrome. Also works as an inexpensive antiemetic, a drug that helps prevent vomiting. Off-label, again, it can be used for sleep apnea. Possibly it decreases the visual hallucinations of Parkinson's disease when you have the psychotic manifestations. Sometimes it's good for hives, good for people who are withdrawing from the atypical antipsychotics and have some symptoms. Also good for the social anxiety disorder, panic attacks for some people. Post-traumatic stress disorder and people with a low appetite. Doesn't seem that food bothers the medicine very much, so you can take it with or without food. Doesn't change the rate or the extent of absorption. When you have symptoms of depression, it seems that mirtazapine or Remeron probably works a heck of a lot faster than the SSRIs, Prozac, and similar drugs. It works in a similar fashion, similar time fashion to the tricyclic antidepressants, drugs like amitriptyline. Seems to cause improvement, often within 1 to 2 weeks. Full effects, well, they might be delayed still till around 4 weeks. You begin therapy at a dose of 15 milligrams a day. Take the entire dose at bedtime. If there isn't any benefit at 15 milligrams, then after a week or 2, not sooner than a week or 2, but after a week or 2, you can gradually increase it, first to 30 and then to 45 milligrams. You should only do that every 1 to 2 weeks because the elimination half-life is about 20 to 40 hours, so it sticks around for a long time. And you have to realize that in the elderly individuals, there might be a gradual accumulation because of a decrease in the kidney function. Well, as with any other kind of antidepressant, it seems that you need both the acute treatment to control the depression. That usually occurs within somewhere around 8 to 12 weeks, but then you need follow-up therapy. You should continue the drug, not necessarily at the same dose. So the acute treatment dose and the maintenance dose might not be the same. So you need continued evaluation. Also have to screen for bipolar disorder. So it's not really helpful because there's the concern that it might precipitate manic attacks. So with any of the antidepressants, that's always a possibility that the depression that you see the doctor with is actually the first manifestation of the bipolar disorder, and the mania is going to come later. So you need a detailed family history, whether there's suicide or bipolar disease or mania in the family or depression. Careful personal history, too, of psychiatric conditions. Mirtazapine or Remeron is not approved for treating bipolar disorder. And as with all of the antidepressants, there's a label, a special warning that it might increase suicidality. The thoughts of suicide or actually even committing suicide. That's with all antidepressants. Seems that there is indeed a small increase in risk in children and adolescents and young adults, but after you get past age 24, the risk of suicide actually starts to decrease, and in senior citizens it seems like it's lower than taking a placebo. Some of the symptoms that some people manifest that we think might either be a conversion to the mania or a risk for suicide would be if you're taking the drug and then all of a sudden you develop anxiety or agitation or hostility or impulsivity or aggressiveness or panic disorders, or all of a sudden you can't sleep or you start moving around, then you've got to go see the doctor right away. The drug, when it was approved, it was so long ago, that the diagnosis of depression was defined by the American Psychiatric Association third edition of what's known as the Diagnostic and Statistical Manual. Well, in order to meet the definition, a person had to have a prominent and relatively persistent, that means lasted every day for nearly 2 weeks at least, either depression or dysphoric mood that interfered with the daily function, and it could affect the emotions or the cognitive abilities or the somatic or the behavioral abilities. Some people are more affected emotionally, some people are more affected with somatic, if they think their joints hurt or they think they have headaches or something like that. Well, in addition to that, in order to make the diagnosis of depression, you had to have at least 5 of 9 pre-specified symptoms. They are depressed mood, of course, loss of interest in the usual activities, significant change in weight or appetite, insomnia or hypersomnia, sleep a lot, psychomotor agitation or retardation, either don't move around or can't stop moving around, increased fatigue, feelings of worthlessness or guilt, slowed thinking or impaired concentration, and then the thoughts of suicide. Well, mirtazapine, no question about it, seems to be better than placebo for depression, for anxiety, for somatization, for sleep disturbances. The studies, however, when they were done to get the drug up for the FDA approval, the studies only lasted about 6 weeks in adult outpatients. The mean dose was anywhere between about 20 and 32 milligrams. Longer study was about 40 milligrams that did indeed show that maintaining therapy seemed to reduce the risk of recurrent depression. It seems like Remeron or mirtazapine is at least as effective as other antidepressants for anything between mild and severe depression. It's at least equal to amitriptyline or Elavil or trazodone or the SSRIs like fluoxetine. It can be used in augmentation strategy. So you can take the mirtazapine in addition to the SSRIs or the SNRIs or the tricyclic antidepressants. Combination's relatively safe, oftentimes prescribed together if the one drug doesn't relieve the depression to a sufficient degree. Actually, combining Effexor with mirtazapine or Remeron, that's often referred to as California rocket fuel. Combination not only helps with the depression, but it also minimizes some of the side effects of the other antidepressants. So when you take the Remeron, it might reduce some of the symptoms that you have from the other antidepressants like anorexia or loss of appetite, or sometimes they can cause sleeplessness. Well, that's counteracted by the Remeron or the mirtazapine. Sexual dysfunction and nausea and diarrhea can be counteracted by the Remeron. So that's relatively good. Well, it's often prescribed, as I mentioned, when not only do you have the depression, but you also have anxiety and insomnia. So when you take it, fewer awakenings, get to sleep sooner after you put your head on the pillow, and you have a deeper sleep. And also if you have erectile dysfunction or some of the other sexual disorders associated with SSRIs or other antidepressants, seems that Remeron or mirtazapine might correct them. Now, in a Cochrane evaluation, there was no evidence that it was helpful in treatment-resistant depression. And in an article in the JAMA Psychiatry, Journal of the American Medical Association of Psychiatry, a look at 87 randomized controlled studies of antidepressants in general, not specifically with mirtazapine, but the antidepressants only seem to have about a 14% better response with depression than simply taking a placebo, and at least 50% of people improve either very little or could become worse when they take antidepressants. So at least at the present time, we don't have a perfect solution for depression. Well, in 2010, the National Institute of Clinical Healthcare Excellence over in Britain, they said that SSRIs is probably the first choice, mirtazapine probably a second choice. However, mirtazapine didn't show any differences as far as the efficacy, the effectiveness, compared to the other antidepressants in terms of achieving a remission. No long-term difference. It seemed that it acts quicker than the other antidepressants, but in the long run, that probably isn't all that important, because after about 4 weeks, they all seem to have basically the same kind of effect. But if you take the mirtazapine, you're probably less likely to stop it because of side effects. Again, we have that faster onset that I mentioned. It helps you fall asleep more quickly. Actually, when they combined the studies and looked at 21 antidepressants, what they found in a comparison study in 2018 was that mirtazapine was among the more effective antidepressants. And it was in the middle group for the tolerance to the medicine. Well, what are some of the side effects? Side effects, number one, somnolence. You get tired when you take the pill. That's why you take the pill at bedtime. Well, some people become dizzy. Some people, actually, about 1 in 6 increase the appetite, increase the weight, and about 1 person in 14 going to gain at least 7% of the initial body weight. And in the pediatric population, probably somewhere around half of the children are going to gain at least 7% of body weight, not approved for children. Sometimes can lead to constipation or can lead to dry mouth, increase the cholesterol, increase the triglycerides in a small percentage of people. And if you happen to have narrow angles in your eye, it could precipitate an acute attack of narrow angle glaucoma. Well, other side effects include psychomotor restlessness, being subjectively distressing and unpleasant. You want to move around, you can't sit still, can't stand still. Usually that occurs within the first couple weeks of therapy and tends to resolve on its own or resolve when you lower the dose. And in some people, it might be associated with a low level of sodium in the bloodstream. Rarely it can activate the mania or the hypomania, sometimes lead to seizures or orthostatic hypotension. That's when you stand up, you get a little dizzy, and then you feel like you're going to faint. Rarely it can cause a decrease in the white blood cells, and really hasn't been studied in people who have a history of heart attacks or other kind of heart disease. When we compare it to some of the other kind of medicines, like the tricyclic antidepressants, seems to cause less tremor, less cardiovascular effect than the tricyclics, seems to cause less nausea, less sexual dysfunction than the SSRIs, and can improve some of the SSRI effects. For instance, sometimes the SSRIs cause you to suffer from insomnia or urinary retention. Sometimes they cause excessive sweating. Well, with many of the drugs, but much less so with mirtazapine, there's the chance of developing what's known as the serotonin syndrome. That tends not to be a major issue with mirtazapine, but sometimes it may occur, especially when it's taken with the MAO inhibitors. Symptoms of the serotonin syndrome, well, mental status change, so people become agitated or start to hallucinate, have delirium. Sometimes they have some neuromuscular symptoms. Neuromuscular symptoms can be anything from tremor or rigidity or increase in the reflexes, incoordination. Sometimes autonomic instability. The heart rate goes up, the blood pressure is very labile, changes a lot, get dizzy, start to perspire, and skin looks flushed, increased body temperature, and sometimes leads to seizures or gastrointestinal symptoms like nausea and vomiting, diarrhea. doesn't tend to be a major issue. And as a matter of fact, a drug that works on the serotonin system the same way that mirtazapine works, drug known as cyproheptadine, seems to be the treatment for the serotonin syndrome. So something to keep sort of in the back of your mind if something unusual happens when you're taking the drug. Interactions, well, with clonidine, it can lead to an increase, a very severe increase, a dangerous increase in the blood pressure. There's a risk of the serotonin syndrome with the MAO inhibitors. If you combine it with either alcohol or Valium, they're all sedatives, so you might fall asleep and stay asleep for a longer period of time than you anticipate. Drugs that either inhibit or induce certain liver drug metabolizing enzymes. These are enzymes that are in the liver that metabolize most of the drugs. Well, might be an issue, but fortunately with mirtazapine doesn't seem to be an issue. Even when you take the azoles, the antifungal drugs, or the protease inhibitors for HIV or erythromycin or Paxil, tends not to be a problem. Discontinuation, again, not a problem like we see in some of the other antidepressants. So you can stop the medicine. If you stop it, you should stop it mildly, slowly come off of the medicine. But even with abrupt discontinuation, it's just usually little mild nausea and vomiting and sweating and headache and dizziness and ringing in the ears or some tremor. Sometimes peculiar sensations in your fingers and your toes. We call them paresthesias. Sometimes they feel like electric shocks. Sometimes people have some anxiety or fatigue or confusion. Overdose, relatively non-toxic drug, especially compared to some of the others. So if you take 30 to 50 times more than you're supposed to, chances are not going to have all that much trouble. Completely different than the tricyclic antidepressants, where you can get in a lot of trouble if you overdose on amitriptyline. Total, there have only been about 12 deaths associated with the drug, and even then, some of the drugs for, some of the effects rather, are in people who are taking other kind of drugs. So one person was reported to have died from an overdose, but they also were taking amitriptyline and they were taking an antipsychotic that's not available in the United States. And the person had only taken 30 to 45 milligrams of mirtazapine or Remeron, and they had taken toxic doses of the amitriptyline and the antipsychotic. So again, it doesn't seem that that's a major problem. Most of the people who overdose recover. Sometimes you have some disorientation or some drowsiness or some impaired memory or increase in the heart rate. But if you take the mirtazapine by itself, not going to have any changes in the electrocardiogram, probably not going to have coma, not going to have any convulsions. It's a tetracyclic compound, so it's present as two mirror images. It's like one molecule looking in the mirror and seeing the other molecule. Now the molecules do something a little bit different. The S or the plus drug, that antagonizes the serotonin 2A and 2C receptors. The R, or the negative enantiomer, that antagonizes the serotonin 3 receptors. And that drug, the R form, or the negative form, is present 3 times more in the serum than the S enantiomer. Both of them block the histamine receptor, so they're great antihistamines. That's why they make you go to sleep. And they also seem to work on the alpha-2 adrenergic receptor. So we call them an NASSA. The NA is noradrenergic and specific serotonergic antidepressant. So this is a family in and of itself. Doesn't seem to block the sodium channels, doesn't block the calcium channels. So it tends to not cause any anticholinergic activity. However, some people still are going to get a dry mouth and get some constipation and get some dilated pupil that can cause the problem if you happen to have the narrow angle that we talked about with the narrow angle glaucoma. Well, overall, the drug seems to be relatively well tolerated. There's rapid and complete absorption. The bioavailability is about 50% of the medicine. Half-life, as I mentioned, is anywhere between 20 and 40 hours. The peak concentration in the plasma is within 2 hours, a steady state within 5 days. About 85% floats around bound to plasma proteins. The elimination is about 75% in the urine, about 15% in the feces. Hasn't been studied in pregnant women, but it's probably best to avoid. In rats, in studies, it shows an increase in the post-implantation loss of the embryo from the uterus. Lactation, there's some that's present in the breast milk, so it's probably best to avoid. Pediatric use hasn't been established that it's either safe or effective. And in older people, especially older men, there seems to be a reduced clearance. So if we look at older men, it seems that the concentration in the serum is about 40% more than it is in younger men. That means it can lead to more confusion and sedation as older people become somewhat more fragile. Now, there's a minimal effect in older women. If you have renal insufficiency, if your kidneys aren't working well, you have to take a smaller dose. If your liver doesn't work so well, again, a smaller dose. It seems to be carcinogenic in test animals, not in humans, but in test animals. It causes liver cell adenomas, liver cell carcinomas, and thyroid follicular adenomas, but the drug is not mutagenic. No routine laboratory is necessary when you take the drug. It was first synthesized by a company called Organon in 1989, approved in the Netherlands in 1994. And interestingly, even though it's called mirtazapine, the suffix apine, it has no relation to the benzodiazepines. Actually, the benzodiazepines, their suffix is azepam, like lorazepam, or azolam, like triazolam. That's a sleeping pill. Well, there's a problem with the veterinary product. Actually, animals have issues too. And one of the problems that's ongoing as of at least January of 2020 is that they put too much in the pills. So instead of having the 7.5 milligrams that the bottle is labeled, actually has 15 milligrams. So the cost of the drug for humans, of course, the generic cash, anywhere between a low of $30 and a high of $56 cash, that's for a month worth of therapy. The highest price at Walgreens and CVS. If you have a coupon, it's only about $10 to $20 for a month. If you want the Remeron, which is the brand name, cost you anywhere between a low of about $190 and about $290 if you go to Walgreens, but if you have a coupon, anywhere between $167 and about $180. So Remeron or mirtazapine, it's quite useful for treating depression, especially if you have the depression coupled with anxiety or insomnia as an antidepressant. It seems to be about as good as any of the other antidepressants. Seems to work in combination with some of the antidepressants. If one doesn't help, then you can add on a second. And actually, mirtazapine by itself has a lot going for it. It's worthy of consideration as an antidepressant, and maybe because of its side effect profile, it's a heck of a lot better than some of the other medicines that are on the market. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified when we post new videos. I appreciate your interest. I'm Dr. Ken Landau.